Hello, I'm Paul Roberts and I'm the Chief Executive of Abertawe Bro University Health Board. As a health board, we've worked with BAVO for a very long time, and we work very, very closely. Our relationship with BAVO works at all sorts of different levels. So BAVO helps us with our overall planning. So we have a number of organisations called commissioning boards where we look very carefully at the health needs of the local population to decide how best to meet them. And BAVO have kindly provided us with representatives to sit on those commissioning boards to help us plan better. So for instance, we're trying to increase the number of people that take up bowel screening in order to prevent cancer. We know how to do that on a statistical basis and what our population needs, but working with an organisation like BAVO means that we actually get ways of targeting the people who are unlikely to take up screening through local third sector organisations, and that means that we get better take up and then fewer people will get bowel cancer. So one thing we're doing at the moment is something we call the big fight, and that's to try and counter the misuse of antibiotics. Some antibiotics are prescribed far too much, and that's partly because people are asking for them, but actually they're not very good for the health of the community. But in order to try and change attitudes to using antibiotics, we need actually to get right into our communities. And as an NHS statutory organisation, we can find that quite difficult to do. So working with BAVO, we've had some really good introductions to local organisations where our experts are able to come to their meetings and directly address some of the people who are influencers in their local communities and help changing the viewpoint of communities about using antibiotics. Another one I could mention is the better discharge arrangements for patients coming out of the Princess of Wales Hospital. Obviously, when someone is discharged from hospital, it's quite a vulnerable time for them because they've been very sick. We need to make sure that we've got the right things in place in our local community. So we've worked with BAVO about trying to get good relationships with the right third sector organisations to ensure the right support is there for people being discharged from hospital, so that when they get back they're supported in the right way and they're likely to thrive and recover from the illness that took them into hospital. I think it makes an incredible difference. We're a statutory government funded organisation, but what we get with BAVO is real deep reach into our local communities. You can actually get to the people you need to get some of the messages over or get some of the right arrangements in place, because BAVO link with so many third sector organisations have such a deep knowledge of our local communities that it means that the things we're trying to do in a targeted way, working with local communities, can be done so much better and so much more effectively.